All right. Hello, everybody. I am Dr. Jackson. I'm a gynecologist and I have an OBGYN practice located in Plano, Texas. Here at the clinic, we specialize in obstetrics and gynecology, and we have a midwifery services here as well. The most common issue that I see here at the clinic would be infertility. There are many women that are under the age of 35 that were presented in the office and not had conceived a baby after having unprotected sex for over a year in the time frame. There are many women that have brought the concern since they have had the inability to produce after they were trying to have a baby. The main symptoms that were common were abnormal periods, irregular periods, no periods at all, painful periods, skin changes, sex drive changes, pain during intercourse. Very common causes are from ovulatory dysfunction, tubal factors, or even unexplained explanation of infertility. The treatment options vary from woman to woman because it just depends on a number of things. And it includes different fertility drugs, hormone therapies, and even surgery. The nature of the treatments is based off age and prior medical history, and mainly for those up to the age of 35, we recommend that they try to get pregnant at least after a year of having unprotected sex, and if that doesn't work, then we'll try for testing. Then for those patients that are between 35 and 40, it's about 6 months of trying with unprotected sex, and then testing should be done. But for those patients that are older than 40, we do treatment right away just because of the age. I had a patient that was presented in my clinic. She was a female in her 30s, 37 years of age, African American with no prior children. Patient's upper class woman with no prior issues besides a family history of infertility and asthma. Patient diagnosis: she had an infertility due to large intramural fibroids, and the patient had several ultrasounds to confirm the fibroids that were blocking the fallopian tubes was causing abnormal uterine contractions. I recommended a myectomy to remove the fibroid tumor since I have experience with this procedure and minimizing the amount of blood loss since a myectomy can be very bloody. And there also the issue with myectomies is by the fallopian tubes it causes an adhesion foundation. So you have to make sure that you specialize in that. Prevention, I would say conceive a little bit younger, avoid drinking and drugs, maintain a healthy weight, and practice safe sex so you don't have issues like pelvic inflammatory disease, which causes those issues as well. Conveying the fact that each case is on a case to case basis, I think we should analyze the symptoms, figure out the solution, execute a treatment plan as quickly as possible. The problem that still needs to be addressed is the unexplained cause of infertility. There are many different ranges of causes that sometimes can't be narrowed down to what's causing it. There are many different diseases, pelvic inflammatory disease, or even to even get that, you have chlamydia that goes unrecognized and leads to that, or sometimes you have unrecognized syphilis, things like that. So there are different many diseases or conditions that mimic, or even after both the male and female have been tested, there's still no cause of infertility. We need to focus on spending more time on different causes of infertility, spend more time trying to narrow down, piece together the early symptoms. And the moment that the patient is complaining of the issue when it comes to infertility, we need to, at that moment, use adequate testing and do everything that we can to try to narrow it down while it's early. That way, once they get into 35, 40 range, they've already been tested. They know what it is that's causing it, whether it's their uterus or their ovaries, or the fact they're not producing eggs, or their uterus is shaped incorrectly or shaped a little out of order, or anything like that. But we should be able to start narrowing it down the moment that the patient is complaining of the issue. I believe that overall, if we spend more time doing adequate research and testing on women, I think, and if we do more studies geared for women, then we will have more women that will be reproducing babies. Thank you.